I'm Ruth O'Regan. I'm a professor and chair of medicine at the University of Rochester. Quantum dots are essentially a type of nanoparticle. So there's a lot of interest in nanotechnology for diagnostic purposes and also therapeutics across cancer in general. So specifically, quantum dots are metal-based nanoparticles that, like other nanoparticles, you can basically conjugate antibodies onto. You can actually put agents in the center of the nanoparticle to kind of develop a targeted therapy. The problem with quantum dots is because they have heavy metal as part of their chemistry, they're not really something that you can use in humans. It's possible they might be excreted intact, but there is concern that there could be quite a bit of toxicity from the metal involved in their makeup. And what we had done previously with quantum dots was use them to try and do multiplex diagnostic approaches to breast cancer. So, what's done when somebody's diagnosed with breast cancer currently is use an antibody against estrogen receptor, an antibody against progesterone receptor, and one against HER2, and usually one against Ki-67. By using a quantum dot or the nanoparticles, what it allows you to do is basically put all the antibodies essentially on the quantum dot and basically have kind of one means of assessing both the expression of these proteins on the cells. So that was one of the things that we were doing with quantum dots previously. I think there are a number of ways you can do that now, where you can measure essentially multiple antibodies at one time. But using quantum dots is just one way of doing it. However, nanoparticles themselves, obviously they have been leveraged in cancer. And there's a couple of examples of them that we use in breast cancer. The first one would be liposomal doxorubicin, which is a nanoparticle. And that essentially is doxorubicin given in a formulation where it's less toxic, particularly to the heart. And that is a drug that is approved for metastatic breast cancer and also ovarian cancer. Um, it's actually it's a nice option for patients because it's given every 4 weeks and its toxicity profile is reasonably favorable apart from hand-foot syndrome. So again, its advantage is that you can give more doxorubicin because of this nanoparticle formulation because there isn't the same risk to the heart. And the other nanoparticle that we use in breast cancer is nab-paclitaxel. And that's basically a nanoparticle formulation of paclitaxel, which actually, the nanoparticle is surrounded by albumin, essentially. So it takes advantage of the albumin take-up mechanisms of cancer cells. The idea really with this drug is that you're going to have more targeted delivery into a breast cancer cell or another cancer cell, but less off-target toxic effects that you see with regular paclitaxel. And that was true up to a point. We certainly do use now paclitaxel, but unfortunately, just like paclitaxel, it can cause neuropathy. But it is a drug that we do use, particularly in metastatic triple-negative breast cancer in combination with atezolizumab. So I think the whole field of nanotechnology is still very early on. And I do think this technology is something that I think we will be using to treat patients with cancer going forward. I think one of the thoughts would be, could you use a nanoparticle to actually localize the cancer, have an imaging component to it where you could actually image it and see where the cancer is, and then along with that actually deliver a payload of some agent to the cancer cells to really have kind of precision targeting of cancer cells. And I think that's kind of where we're going to see nanoparticles used going forward. But I can tell you, if you go to any study section, every second grant is about nanoparticles. So I think we'll hear a lot more about them.